I'm going to talk about nerves. I love nerves. Somebody mentioned pronator teary syndrome before I got all excited. Nerves are really amazing things, and they do some really weird things. And I know you have players who will develop nerve issues, and most of the time they'll be the typical nerve entrapment, sometimes nerve injuries, but sometimes really weird stuff can happen. We're going to get into this in a little bit. And it sometimes takes beyond your physical exam and usual diagnostic studies to sort this out. Sometimes advanced nerve imaging is required. And I would encourage you, whenever you have a player with a potential nerve problem, involve a nerve specialist so they can utilize some of these techniques, because sometimes these weird things can mimic the common nerve problems, entrapments, and injuries, but they're not really that. And if you send the player down the wrong treatment pathway, they really won't get back to play quickly enough. But if you get them to the right person and get them the right imaging to get the right diagnosis, then we can get them to the right treatment. So we're going to go through three cases. And again, we can kind of modify based on timing, and just let me know if I'm going past. This talk applies not just to baseball players, but to athletes in general, and really humans in general. All this stuff is applicable to everybody out there. So we have a recreational athlete with a fall and then a nerve problem, a mixed martial artist who treated his pain from training with cannabis and then developed horrible nausea and vomiting, and then had a nerve problem, and then a 21-year-old professional baseball player who developed this weird nerve thing during a game. So the diagnosis of nerve, like as I alluded to before, history, physical examination, electrodiagnostic studies, and your clinical judgment. And when I was training 20, 25 years ago, that's all we had. And we did a lot of surgery just based on best guesses. But now with high resolution diagnostic ultrasound and MR neurography, which I'll explain here in a second,